Hello.
Hi, can I speak to Jeremy Fisher?
Speaking.
Hi, this is Dr. Anu. I'm calling from Hippocratic Surgery.
Oh, hello, Doc. How are you?
I'm fine, thank you. How are you doing?
I'm fine, thank you.
That's great. Can you hear me okay?
Yes, I can.
Okay, and is this a convenient time to speak with you?
Yes, it is.
Okay. Just to make sure I've got the right information here in front of me, could I just check your date of birth and address?
Yeah, it's the 5th of June 1982, and I live at 23 Blue Square.
That's great. And are you in a private place where we can talk freely?
Yes, I am.
Yeah. We've got a landline on your system that ends in 961. If this connection fails, am I okay to call on that one?
Yeah, that's fine.
Okay. How can I help you today, Mr. Fisher?
So my wife made this appointment for me. She wants me to get the snip.
Okay. And what's made you come to that decision?
A lot of different things, really. We've got 4 children, and my wife doesn't want any more children just because it's a bit traumatic for her with the youngest. So we had a chat and thought we'd give you a call and talk about things.
Sure. And you mentioned your wife a lot of there. Is this something that you want to have?
Yeah, I think our family, we don't want any more children. So we were just trying to think of the best way to do it, really.
Sure. And you mentioned your wife had a traumatic delivery with your
Yeah.
youngest.
She's
What
fine now.
happened?
She just doesn't want any more children.
Okay. Okay, that's fine. What kind of contraception have you already tried?
So, I mean, right now she's using the pill. I'm using condoms. But the thing is, she's been on the pill before, and she got pregnant when she was on the pill.
Oh,
And then we tried the coil, and it fell out. And then she tried something in her arm, an
okay.
implant or something,
Okay.
and it didn't suit her. I can't remember why.
Okay. Okay. And I assume you've also discussed about there's also the female type sterilisation as well. Is that something that
Yeah,
you've
she's not
discussed
keen
as
on
well?
that.
She's not.
Just because she'll need to be in hospital for a long time, from what we read.
Sure.
And
Okay.
we've got young children, and I'm lucky she looks after them. So we need
Okay.
it. She wants to look after them, and that makes a lot of sense.
Sure. Yeah. Now you mentioned you've done some reading already.
Yeah,
And what kind of things do you already know about the SNP?
just know it's better. It's more effective. Um, and so it says you said go and speak to your GP on the website. So
Okay. And here you are.
yeah,
Okay. Were there any specific questions you had from any of the information that you've already read?
yeah, a few. If I'm going to be honest,
Yeah.
it's an operation, isn't it?
Yeah.
Um, is it going to be painful?
Yeah.
And it's an operation down there. Is it going to mess about in my sex life and my sex drive and things? But I think I'm just more bothered about the fact that if I need to take time off work, I'm just not keen on having to explain to work why I'm not at work.
Okay.
I'm just not keen on that.
Okay. And what do you do for a living?
I work for Jaguar Land Rover.
Okay. What kind of activities does your work entail?
Oh, I just do engineering. Sometimes I work with a few machines to make prototype parts, like
Okay.
brakes. But yeah, I'm not. It's not a heavy job.
Okay. Okay, fine. So not much heavy lifting then.
No, just spend quite a bit of time in the office and sometimes in the workshop.
Okay. Okay. So just to make sure I've got all the right information here in front of me, do you mind if I just go through your medical history very quickly?
Yeah,
Just
that's
ask a
fine.
few questions about your lifestyle and then we
Yeah,
can spend some time talking about the SNP.
yeah, that's fine.
Okay. So I can see here you generally fit in well with no medical problems.
That's right.
Yeah. And we can't see any routine medication on here. Is there any medication you
No,
do take?
no,
No.
no, not on anything.
And any allergies at all?
No,
Is there any family history of any problems related to clotting disorders
no,
that you're
nothing like
aware of?
that.
No? Okay. And do you smoke?
No,
No. And do you drink any alcohol at all?
occasional pint, maybe once or twice a month.
Okay. So rarely then.
Yeah,
Okay. So just going on to now speak about the SNP. The other name for it is the vasectomy, and you're quite right from your reading, it is very effective. So it's about 99% effective, and it is supposed to be more effective than having the female sterilisation. It's a procedure at the end of the day, so there's lots of pros and cons. So if for any reason you did change your mind in future, a reversal of a snip or the vasectomy isn't going to be covered on the NHS.
Okay.
So it's just something you need to be aware of. But it sounds like you've had a good discussion with your wife and you've both come to this conclusion.
Well, yeah. I mean, if I'm going to be honest, I mean, is it going to be painful?
Sure. So I'll come on to the questions now that you had for me. So in terms of painful, the procedure is done under a local anaesthetic. So they give you a numbing agent to numb the area before they do the procedure. After the procedure, it's very common that you'll get some bruising and some discomfort around the scrotal region, which is where they do the procedure. And it may be for a couple of days after, you'll be in some discomfort. So in terms of work-wise, depending on the person, there's some people that just go straight back to work. Other people may need a couple of days off. But if you're worried about disclosing to work about your specific procedure, you may put something just general like recovery after a procedure, and it'll be up to you if you want to divulge the information to them.
Yeah.
Okay. As with every procedure, there's some pros and cons for them. So the pros are that your wife wouldn't have to have a procedure done, and it would stop you hopefully having any more children.
Okay.
Do you want me to tell you a little bit about some of the, I suppose, the cons of the procedure?
Yeah, I guess so. I mean, it's worth knowing, isn't it?
Yeah. So you mentioned about pain. So there are a small proportion of people that may have what we call chronic pain happening after the procedure. So that'll be some pain in the scrotal area.
Okay.
So that's a small number of people. There can also be a little bit of bleeding after the procedure. There's also a risk of infection, and some people can have a collection of blood in the scrotum.
Okay.
So those are the main things that you do need to be aware of.
Okay.
Also, after the procedure, it's usually about 6 to 12 weeks after the procedure before you can have sex without needing any condoms or for your wife to come off the pill.
Okay.
And they do a couple of checks on your semen just to make sure it's all clear before they tell you that you're okay to go ahead. So it's not immediately effective.
Okay.
Yeah. Do you have any questions from any of that information so far?
No. I mean, are there any other options other than the vasectomy or?
Sure. So from the male perspective, it's really condoms. There's the retraction technique, so before you come retracting, or something like the vasectomy or the snip that we've already discussed. There are a few more options from the female perspective, but it sounds like your wife's already tried quite a few of them.
Yeah, she has.
And there may be one or two other things that maybe we could discuss with her if that's something that she would like to know about.
No, if it means another operation for us, I don't think we both couldn't put ourselves through that. So,
okay, that's okay. But I think before you make your final decision, I could send you over some more information.
Can you send me a leaflet or anything?
Yeah, so there's a couple of ways that we can look at that. So I can either send you a link to your phone, or I can print you off a leaflet that you can collect from reception, whichever one you prefer.
Yeah, send it to my phone. That's fine.
Okay. Now, Mr. Fisher, the only other thing that you'd ask me about is about your sex drive.
Yeah.
The vasectomy or the snip shouldn't affect your sex drive, so I can reassure you from that side of things.
Good.
Yeah. If it is something that you would like to go ahead with, definitely we can organise that for you today, and we can make the ongoing referral. If you'd like a bit more time to think about it and talk to your wife with the information I'm going to give you, we can do that. Whatever you prefer.
I think it's probably better you just do the referral.
Okay. Do you have any other questions from what I've said?
No, that's fine.
Okay. So I'll make the referral. You'll get an appointment that comes in the post, and you just need to keep an eye out for that. If you don't get any appointment coming through in the next 2 weeks, just let us know, and we'll follow that up for you. Okay. But if you do have any questions before you have the appointment, then you can always contact us, and we can have a chat here on the phone.
That's fine. That's great. Thank you, Doctor.
Is there anything else I can help you with?
No, that's fine. Thank you.
That's great. Well, thank you very much then.
No worries. Thank you.
Bye. Bye-bye.
Bye-bye.